Hi everyone! Thanks for joining me on my podcast today. Today we'll be talking about psoriatic arthritis. Psoriatic arthritis is a condition that affects both the skin and joints, causing pain, stiffness, and swelling. It's a chronic autoimmune disease where the body's immune system mistakenly attacks itself, leading to inflammation and joint pain. So many of you might be asking, what exactly is psoriatic arthritis? You've probably already heard of the term arthritis, which is used to describe joint inflammation. But what is psoriasis? Psoriasis is a skin condition that causes itchiness, scaly patches on the skin, often in the joints, scalp, nails, trunk, and now putting both together, it happens to be known as psoriatic arthritis, which leads to joint inflammation, pain, and stiffness. It can hit anywhere in the body, from the fingers to the toes to the spine. So who exactly can get this disease? Usually, psoriatic arthritis shows up between the ages of 30 and 50, but it can also develop at any age. It can also be seen, it can affect both men and women equally. If you have psoriasis, your risk of getting psoriatic arthritis is higher, especially if you have a close family member that has it. In fact, if a first degree relative has psoriatic arthritis, your risk actually jumps from 70 to 90%. For some people, psoriasis appears first, and arthritis can develop 10 years later. So, a few things to keep in mind when coming across psoriatic arthritis. A few signs and symptoms to watch for will be joint pain, stiffness, swelling, fatigue, morning stiffness, changes in nails. So it can look like your nails becoming disattached. You can also have back pain, specifically in the area of your spine. There can be some inflammation there. You can also have swelling in your fingers and your toes, something that we call sausage digits, which, just like the term says, look like sausage fingers. So psoriatic arthritis can show up in many different ways. Sometimes it's mild, and other times it's hard, and it comes in really fast, very aggressive. So how do we diagnose psoriatic arthritis, you may be asking? Well, there's no single test to determine if you have it. Doctors usually rely on x-rays, ultrasound, blood tests, and joint fluid analysis. Typically, x-ray helps spot joint damage, but newer tools like ultrasound can catch inflammation in earlier stages. Since psoriatic arthritis is a synogenitive arthritis, blood tests won't show the markers found in rheumatoid arthritis, which is why it can be misdiagnosed a lot of the time. So, if you have psoriatic arthritis, how can we treat it? So right now, there's no direct cure for this, but there's ways to manage your symptoms and slowly progress that disease. So, a few things to keep in mind in the treatment plan will be medication, like anti-inflammatory medication, and then disease-modifying drugs, which your doctor will prescribe for you. Another form to manage psoriatic arthritis is physical therapy to keep the joints mobile and reduce some of the pain. Another thing that you can do is lifestyle changes like your diet and your exercise. So, how exactly does physical therapy help psoriatic arthritis? As a physical therapy assistant, our goal is to keep you moving and minimize pain. Some key treatments include stretching, strengthening exercises to improve your range of motion and mobility, soft tissue and joint mobilization to ease the stiffness, which can look like massage, typically in our setting. Using ice, heat, paraffin, and these can also be used to all relieve some of the pain you're currently having. A very fun way for treatment can be aquatic therapy, weight-bearing exercises to keep the joint active without causing any stress. So, lastly, I did want to speak slightly on why the diet matters with having psoriatic arthritis. So, inflammation plays a huge role in psoriatic arthritis, so the diet can make a huge difference. One of the diets that is highly recommended is a Mediterranean diet because it is rich in fish, fruits, vegetables, healthy fats, can help lower inflammation. Also, adding fish oil, which is packed with omega-3 fatty acids, may also help reduce joint pain and protect against heart disease. So now that we're wrapping up the podcast, I wanted to say my final thoughts. So living with psoriatic arthritis can be very challenging, but early diagnosis, the right treatment, and lifestyle changes can help keep it under control. If you or someone know who has psoriatic arthritis, working with a rheumatologist, dermatologist, and physical therapist can make a huge difference. So remember, movement is medicine. Stay active, stay informed, take charge of your health. Thank you for joining me on today's podcast.